So it all started when I started hearing talk around town about folks having a bad reaction to the flu shot this year. The debate in the newsroom never ending. Does the flu shot make you sick? So I had to investigate, and I found a local mom. After years with the nasal spray, her son got a shot at the doctor's office. Then came nausea, dizziness, and swelling. A lot of swelling.
I saw that it was swollen, but it just, in the course of an hour or two, to almost twice the size of his other arm.
For Milwaukee mother Latanya Lavender, this was not the Halloween she anticipated.
Whenever I lay on it, it really does hurt.
Her 10-year-old son in no condition to trick or treat. He also missed school. The result, she says, of a flu shot.
I wasn't happy to know that 24 hours after the injection, he could have such a reaction. They just say to look within a course of time, not that whole day later, your child could have a pretty serious reaction.
Todd's mom says when she took him to this walk-in clinic near their house, she was shocked to find out, as one staffer told her, that several people had come in with the same problem.
They had had several other cases of the same reaction with flu shots.
But when we checked with the healthcare facility's public relations department, they told us they have no record of any cluster of ill side effects associated with the vaccine.
Well, it could be because, again, the vaccines are new.
Waukesha allergist John Bassick tells us the unconfirmed report should not be discounted outright.
I haven't really seen an increase in patients reporting, at least to us. And then again, if you have a reaction, you should probably tell whoever gave you the vaccine so that they can monitor this and possibly report it to see if there really is something going on.
The mere mention of cases like this riles up long-held suspicions about the flu shot. Is the flu shot making people sick?
That's a great question, and I would tell you for most people it's not.
Dr. Margaret Hennessy of Wheaton Franciscan Healthcare is one of the leading local experts on immunization and fighting the flu.
And they compared people that got a flu vaccine to people that got placebo, and really the side effects were the same. There's such mythology around the flu vaccine. There's so many people that are so afraid. So it's hard for me to convince you, if you got a flu shot and then you felt crummy, that maybe it wasn't the flu shot. Maybe it was something you ate that day. Maybe it was someone you came in contact who had a respiratory illness.
Are you getting a flu shot?
No.
Why not? It offers you protection.
It does, but I heard it also gets you sick, and I really don't want to get sick just to feel better.
It's the kind of issue that can divide households. Case in point, Jason Shepard and his girlfriend, who live right across the street from the Southside Health Clinic, which offers walk-in immunizations.
And I'm going to try it and see if it works.
So have you ever had a flu shot before? No. Now you feeling sick today? No.
One big question we get is whether you can actually get sick or get the flu from receiving the flu shot.
And the answer is?
Absolutely not. No, you cannot. It uses a non-live form of the virus. Only the mist. That's the only formulation that's a live virus. It's still attenuated, which means weakened. So there's a very small percentage chance of receiving it. We have a questionnaire we have them fill out, take care of any of the risks there would be to contacting the virus from that.
Even with this information and the fact that many healthcare providers pick up the tab, there are still skeptics.
I think I'll be safer, if I just take my holistic approach.
Which brings us back around to that Milwaukee mother and her son. Even after all they've been through, they're not willing to say no to the flu vaccine. And that's the bottom line.
I think the benefits outweigh the risks, but I think when you're dealing with children and elderly, there should be more information about really what to expect with reactions.
But the information is only as good as the reporting. The CDC has a reporting system. You're expected to call 1-800-822-7967, and we will be following up on this in the months to come. This is only part of the conversation, though, on a complex topic. It's best to talk with your private health care provider on what's best for you. And please, join us tomorrow morning on the CBS 58 Morning News. We're going to discuss which vaccine you should use. You know, there's a high-dose vaccine. Is that really something you should take? We also have great tips on how to minimize side effects. So set the VCR, the DVR, or set the alarm clock. It's on the CBS 58 Morning News tomorrow from 4:30 to 7 a.m.